Hello, welcome to Public Health Hired's part-time and temporary job search session. I wanted to provide a special session on how to find part-time jobs, temporary jobs, per diem, seasonal, contract-based, 1099, and everything in between, so that you can float through this tough time if you're currently unemployed, will be a soon recent graduate, or is just trying to figure out their transition in their life. Maybe you have to move somewhere. Given everything going on this year in 2025, I recognize that public health, the healthcare administration in the United States has taken a huge, huge hit in our workforce, in our career, and just the services that are being provided to our communities across the nation. So I stand in solidarity with all of you who are devastated in what is happening every single day, the unfolding and unmaking of the safety net and the infrastructure of prevention services and everything in between. So, as we continue to rebuild our country and rebuild and fight against the protections that are already in place for our vulnerable communities, I hope that you'll consider part-time work, temporary work, contract-based work, or anything that's not your traditional full-time as a way to continue to stay in the game, keep your head up, have some hope for your career, and just know that this too shall pass. So, with that said, I want to provide to you just this really special session on how to keep you motivated, keep you going, and even lessons from my own career on how part-time jobs have really saved my, I was going to say, saved my ass. Um, I will also share how public health part-time jobs or research-based jobs or anything around mental health even has really helped me in my time of need when I've also been floating, or I left a toxic workplace and I quit a job, or I found myself unemployed. So hopefully this will help you as well. My name is Zoila Reyna. I have my master's in public health, and I am the founder of Public Health Hired. I've helped nearly 400 individuals secure jobs in public health in the last 5 years. So I am the leading public health coach, really mentoring all of you as much as I can with our free resources, as well as our masterclass and mentorship. More information to come on that. I'm going to provide for you what to expect in your job search and how this is different from full-time job searching. If you follow me already on Public Health Hired, whether it's Instagram, TikTok, LinkedIn, YouTube, or anywhere else that you're finding public health hired resources, you'll know that I am the career coach that helps you get full-time work across all sectors, whether it's private, nonprofit, government related, hospitals, and everyone in between. So I am very much about securing that full-time job. I actually left my full-time job about a year ago at Kaiser Permanente in Southern California because public health hired was growing and all of you really needed more of these services. So I'm happy to continue to share what I know about the best practices of getting hired full time. But this special session will focus on part-time jobs and the difference of part-time job searching versus full-time, what red flags to look out for and what to avoid in general, because you do run into some scams. And then temp companies that I highly encourage you to look at if you are considering some temp work. And then if we have time, we'll touch base on how to really use your networking to really continue to grow your job options. So briefly, I wanted to remind all of you that I am a public health professional. I am not your traditional career coach in the sense that I have my master's in public health from UC Davis, and I have my bachelor's in psychology from UCLA. I also ran into public health as a pre-med student, not really knowing um, what was out there besides wanting to be a doctor. So when I graduated with my undergraduate from UCLA, I ended up finding a nonprofit job with the American Lung Association. You'll see here, I'm disclosing my salaries for every single job I've had. On the left is my full-time jobs that I've had over my career. And you'll notice that I've been with the Lung Association across three different roles. That's because I actually left them and then quit and came back. So you can follow my story on my social media if you want to know the details of that. But yes, I did have three roles across the American Lung Association, and it's really because of them, because of this wonderful nonprofit organization in tobacco control and prevention here in California, that I was able to be exposed to public health and really understand it to what it is now. And so I very much recognize, where I got my footing was through the American Lung Association. But from there, when I graduated from my master's in public health, I ended up working at the California Department of Public Health because Sacramento is there, right next to Davis. And so I got to work for the government, which was great. But then from there, I realized I was just unhappy in Sacramento. I was unhappy in Northern California. My life, my social life, my friends, my family, and just the lifestyle that I saw was really in Southern California. And so I quit my job. I'm known for quitting an $80,000 job here with the American Lung Association in the hopes of wanting to seek more. So I leaned onto part-time jobs. That was a bilingual clinical research interviewer for a SAMHSA opioid addiction research at Venice Family Clinic, and it was Rand Corporation that was paying me 24 an hour. I've also worked for Kedron Medical Center. They're known as Kedron Health now, and I was a contract 1099 employee for them, a part-time gig, also with SAMHSA, the substance abuse, mental health services administration of the U.S. government. So I was really lucky to have two SAMHSA grants under my belt, both under RAND Corporation and Kedron. And I want to point out that I found these two part-time jobs in particular, under Craigslist. And I want to say that because a lot of you assume that it's who you know, it's the network that you have. And I just want to clarify that these jobs you see on the screen are not based on who I know. This is based on my merit, on my work ethic. This is based on me um, really putting myself on paper in a way that resonates with these employers and then getting called in for callbacks and then actually nailing those interviews, right? The difference with part-time versus full-time that I can easily share with you here is that my part-time jobs only took about 1 to 4 months to secure. 1 to 4 months to secure is on average what it should feel like when you're looking for a part-time temporary contract job. The reason is because those move quicker. There's less interviews involved. It's not so much that there's less people in the pool of candidates, but I will say that those managers who are looking for part-time employees are grabbing those applications and not letting them sit longer. Unlike full-time, they may be sitting there for a while. In fact, I do share that with my Kaiser job that I just quit about a year ago. They called me about 3 months after I even applied. So total, it took about 5 months to secure that job. My other jobs have ranged from 8 months to getting 5 months, um, and so on. I know the longest job search I've ever done is 2.5 years. I wasn't employed for a portion of that time, but sometimes these transitions take so long, and part-time work really can allow you to float and free yourself of any of your limitations. Maybe you're at a toxic work environment. Maybe you were let go because funding cuts happened, and part-time work is still something you can consider. And this session is going to help you find part-time work that's relevant to our world and to public health and health-related services. So just calling out that any role that you're seeking is ideally going to be health-based, so you're going to have to weed that out. Now, the difference with weeding out jobs in part-time work is you kind of have to be mindful of what you're looking at. In other words, most of these jobs do fall under some of the buckets you see here, like health education, administrative support, some data analysis or data collection is really big for part-time jobs. I know I was a part of that in my work, or research assistants and project coordinators that are part-time. I've been posting lately a lot of jobs that say volunteer coordinator, and I know that some of you are clicking past that, not even looking at it because you assume it's unpaid work. When really sometimes volunteer coordinator is that they're looking for someone to coordinate the volunteers. So it's still paid work. They're just calling you the volunteer coordinator because you're the one coordinating the volunteers. So please be mindful, slow down when it comes to part-time work. The titles might start to throw you off a little bit. You might have some assumptions, but open it up and you might be surprised that it's actually paid work after all. Notice that in Indeed, I wanted to pull up how some part-time work is filtered or categorized. One of the major differences with this kind of job search is that it's okay to actually use the filters. The filters are actually a little more friendly when it comes to this kind of job search. Versus if you were looking for full-time work, I would encourage you not to use filters because when it comes to these full-time employers, they are just churning and running and moving, and they got lots at risk, and that they're just managing to a lot. And they're not always so careful with all of the filters that they're selecting. You have to remember that there are end users who are basically putting these job posts on Indeed, LinkedIn, ZipRecruiter, Monster.com, even Craigslist. And so the chances of error is higher when it's full-time jobs because they're just out there managing to lots of full-time jobs, especially if it's a larger company versus part-time. The difference with part-time is that there's less at stake, there's less benefits, there's less cost, there's even less qualifications and duties that are listed. So by far, the tailoring that you'll be doing for your resumes, you can breathe a little bit more. It's not as aggressive, it's not as intensive. And in fact, I encourage you to really start practicing the hired methods as you approach the part-time job applications because that'll really prepare you for the full-time job search when you get there. But just so you know, when it comes to full-time job searching, the only filters that matter is the date posted. So look for the freshest, the better, 24 hours to 7 days posted. And then whether you want it to be remote, hybrid, or on site. Any other filters around salary or career level, entry level, anything like that, just skip past it. Because sometimes the end user, the HR staff that is posting these jobs is not selecting all those filters and you're getting weeded out because you're just not using the filters correctly. So that's my big spiel on filters. Yes, use them for part-time because look at all the ways that they're flagged, right? Versus full-time, they only call it out once one way. It's full-time. And so you don't need to select that box when you're searching full-time. It's a different way of weeding through the jobs. Another thing that I want to point you guys to is the search engines that you're going to use for part-time. I just said that I used Craigslist to find my part-time job for RAND as well as Kedron Medical. And I even found my full-time job at the American Lung Association, the first job I got as project coordinator, making 45,000. I also found that job on Craigslist. And for a minute, I thought it was going to be a scam because it sounded too good to be true. But I saw that it was the American Lung Association. They cited that it was grant funded by the FDA, the Food and Drug Administration. So it seemed very legit. It did sound already odd because it was a job to help with undercover investigations for tobacco retail and involved training youth and working with the FDA investigators on this. So the nature of the work was a little weird and scammy sounding on top of the fact that it was posted on Craigslist. But I took my chances and lo and behold, I got the job and it's been my public health career training ground and I'm super proud of it because, it taught me a lot of what I know now working in communities. So all of this to say, don't knock Craigslist, don't knock Craigslist. Yes, there's a lot of weird stuff you're going to find, but I recommend that you stay in the section of nonprofits. The reason that people don't like Craigslist, number one, is because it's clunky. Number two, because yes, there's some just schemy things that are going on Craigslist. And stuff that, you don't want to find on the internet. Okay. It's not like networking. It's not about networks. It's not about companies. It's not like flashy and, it doesn't allow you to start conversations with people. So yes, I get it that it's a little antiquated and a little clunky, but I want to remind you guys, I want to remind you that you have to follow where the employers are. It is your job to find these, it is your job to find these jobs. Okay. And I'm letting you know that employers find Craigslist to be super, super easy to use, super easy to post. There's very little engagement they have to do to get their job posted. There's very little fees, if any fees. I think nonprofits can post for free actually on Craigslist. So versus LinkedIn, there's just different things that you're running into, and you have to maintain the company profile, and you have to, compete with everyone else who's posting for these jobs, and actually pay for the sponsorship of it to get posted higher. So there's a different feel when it comes to posting Craigslist, and these companies can just post it and just forget it. And that honestly is why you will find some really great nonprofit jobs being listed on Craigslist. So that's my spiel on Craigslist. Don't knock it. The other reason you guys don't like it is because I forgot to mention, is because Craigslist is about local, right? So it doesn't list remote jobs. It lists jobs in your backyard. So the jobs that I got, I was aware that I was going to be expected to be available on site or whatever. So that is one of the things to be mindful of is Craigslist is more about helping you look for jobs in your backyard because it is about the community. So it's less likely to post remote jobs. With that said, enough of Craigslist. Indeed, LinkedIn, ZipRecruiter, Monster, Handshake, any other website you find is fine to look for part-time jobs. The only thing with LinkedIn that is evolving, and I talk about this during my masterclass office hours, come join us on Tuesdays, 9 a.m. Pacific, 12 p.m. Eastern, if you're interested on learning more on how to find jobs and actively job search. What we're talking about and discovering is that people from the companies that they're hiring will ask the staff to post open jobs on their feed, on their personal feed, instead of the company using their company profile to post for jobs. So what this means is that, Zoila, if I was still Zoila working at Kaiser Permanente and my boss wanted to hire someone, she wouldn't ask HR to post the job on LinkedIn. She would ask me and our colleagues to be like, hey, HR posted the job on our career site. Can you guys grab it and share it with your network? So that's making it harder for us as the public health workforce to really find those really cool jobs, at companies because they're not necessarily being dumped on the job board. So please keep that in mind. That's why you have to grow your network on LinkedIn. That's why you have to make friends with strangers, because if you want to stay in tune with these companies across the sectors that I teach you, nonprofit, government, philanthropy, hospital health plan, universities, research, large NGOs, and everything in between, then you have to grow your network. There's just no way around it. So go make friends with strangers, say that you want to, connect, and just let LinkedIn work its algorithm to your favor. Okay. Now, to the left of this slide, you'll also notice that I mentioned some temp agencies. So these three temp agencies for the last 5 years, I have found to be really great resource. Now, they have their ups and downs. So maybe one quarter they're not posting a lot of jobs, but then another quarter or another year, they're actually a little bit better. So Partners in Diversity, they're a small women-owned business, but they post jobs across the nation, remote as well as hybrid and on-site. So it's a good mix of options. Contract-based, seasonal. It's a mix of full and part-time. So I like them because they seem to be able to attract really good contracts with good variety. Then you have healthcare staffing professionals. That's HSP, also known as a True Blue company. I think they're being bought out. But basically, they have their own public health site, or they did for a while. But they know public health really well. Their recruiters treat our followers really well and they know what they're talking about. So I definitely recommend looking up healthcare staffing professionals and then Insight Global. Now they have more tech and business or finance, and then they'll occasionally have some healthcare or community health work. So of all the three, they kind of are more of the hit or miss, but lately I found some stuff that I like from them, so I'm gonna keep promoting them. So these three seem to be reliable. There are other temp agencies out there. I did talk to someone recently that was hired by the state of Tennessee by Software Technologies Inc. And that was kind of unique that the contracting agency was like an IT company. She seems to be helping with operations, but she's not an IT person. She's a healthcare public health professional, just like you and I. So I just want to point out that even the name of companies sometimes may be a little elusive on just the job that you might be eligible for. So you can rely on these three to point you to the right direction in the meantime. Wanted to just mention, moving quickly, in the next few minutes, I'm going to share my screen and show you like certain part-time jobs that I've been finding lately to give you a little bit of hope on what to look out for. But you'll see here that the key terms to consider when looking for work are really around your time commitment. So unlike full-time, you don't really need to type the word full-time. Um, Instead, you are asked to type in the skill set and focus areas that you're interested in. And then from there, you would filter out jobs and weed out jobs and save the jobs that are most aligned to what you're looking for. The biggest difference with part-time is that you're actually going to use the time commitment as a search strategy. Okay. So because these jobs that have part-time job, these companies that have part-time job options will tag it as part-time, will include in the title the word part-time, will mention it's temporary or contract in the job description itself, then you're more likely to find them. So these are some ways that I search in the actual search engine. So when you're in LinkedIn, when you're in Indeed, and you're at the top figuring out what do I search, what I search, you can search part-time or PT or zero point 0.5 FTE. 0.5 FTE means half of a full-time employee. And yes, I have seen jobs pull up if you type 0.5 FTE. You will be surprised. Um, the other thing to consider is, yes, you can still search based on skills or focus area. Here at Public Health Hired, you will know that I teach you to stop searching the word public health or the term public health in order to find jobs. That just doesn't work. There's just no way that you're going to get hired if that's your strategy. In public health, the jobs are elusive. They're hiding even more so given all the changes with the Trump administration and the federal agency. So you really are asked to think outside the box around where are these jobs. So all of this to say that yes, people are still getting hired in public health. Last week, I celebrated 4 people who got jobs, full-time jobs for the state of North Dakota, state of Tennessee, and a couple universities. So there are jobs being offered, but given how difficult it is that it takes 4 to 8 months to secure those jobs, I'm asking you to consider part-time or temp through this strategy instead. So yes, whether you're looking for full-time or whether you're looking for part-time, you need to think outside the box and think of the skill sets and focus areas that describe your interests, that describe what you already have demonstrated and you can continue to grow in. If you're not sure where to start with the key terms, I have a guide. It is at publichealthhired.com. It's free to download and it's right next to the job posts that I will show you in a minute. But if you're not sure what to use, that free guide is your first stop to help improve your job searching altogether. And then lastly, I want to mention that there are some titles that are common for part-time, like standardized patient is something that you can get a job for at a hospital or at a university that teaches doctors, and they're usually looking for like someone who can be their control subject to teach them on illnesses. So that's kind of a fun one, but that is called a standardized patient. I see it posted often. Then there's proctors, or test administrators, community health workers, health educators. That bottom is supposed to say volunteer coordinator. Sorry for my typos. But yes, there are some jobs that you can rely will likely have a title that could potentially be part-time as well. So something to look out for. So now I am going to switch us over to publichealthhire.com so you can see the jobs that I posted for the week of August 25th in time to show you what part-time jobs and temporary jobs are out there. So I'm going to switch back and share my screen again. So when you go to publichealthhire.com, you'll be able to scroll down into the middle and see where there is the key terms guide that I was mentioning that you could grab to help you improve your job searching. This is a 20-page guide with 70 key terms that is valuable across all employers, all sectors, whether it's nonprofit, government, private companies, universities, healthcare, and everyone in between. This key term guide will help you rest assured that what you're studying, what you're making sense out of these jobs is still in line with what you're looking for. Because a lot of us are stuck in our own loop, in our own search loop, and our algorithm is not showing us all of the jobs available in relation to our transferable skills. And this is meant to do that for you. This key terms guide is meant to help you break out of your limitations, break out of those walls, break out of your search loops, and really see where your transferable skills can really take you into your next job. So that's the key terms guide. And then in regards to the weekly job search, I post weekly jobs here at publichealthhire.com. And when you click on it, you can rest assured that these are the freshest jobs in the job market. So it's about 15 pages now because I've been doing it for the entire year of 2025. So you can see the jobs that are freshly released of that week. And I encourage you guys to look for the freshest jobs as possible to apply to because it gives you just enough time, just enough couple days, 2 to 4 days to turn around a tailored resume and cover letter in time to actually submit. Mind you, these jobs are getting pulled down faster and faster. So, you have to get better and better at your tailoring. And I teach you in the master class on where to spend your time, stop with the burnout, because I guarantee you, you are wasting a lot of your time on what to be tailoring. So here I wanted to point out that there's a couple of in this week's job alerts for August 25th. I posted unique listing for part-time or temporary because I wanted to raise more part-time. The other jobs you see here are all full-time and mostly remote because our community really wants more remote jobs. But you'll notice that health staffing professionals, as well as partners in diversity and Insight Global, have some options for you to consider. There's a mix of remote part-time, like here for this oral health evaluator. And then there's a mix of part-time on site. So here I think the ones listed in California are for Southern California in particular. But I also found Adecco. Adecco is a part-time, I'm sorry, it's a temp agency, Adecco, and I'm not too familiar with them. They seem to be mostly East Coast, Midwest. So they're kind of new to me, but I have seen them in the past. And so I posted their job options as well. So I just want you to be aware of how some of these jobs are listed, like even this one from PIH Hospital, as well as Environment America, where it looks like they want you to be a volunteer, but that's not the case. In fact, they want they want to pay someone, right? So these two, They want to pay someone to be the volunteer specialist, to be the part-time volunteer coordinator. So they need someone to help manage to volunteers, and they're willing to pay this person part-time salary or just part-time hourly, right? So that's the idea is please be careful because sometimes I talk to you guys and you see these titles and you think that they just want someone to work for free. And it's like, no, this is a part-time job that they will pay you for to manage to those volunteers. There's a lot of work around veterans. So there's one job on here called Virtual Reading Assistant for Veterans, posted by Ladva Corporation. But I thought this was great, a great example of reminding us where jobs are. A lot of the focus areas or topic areas that are rising in 2025 are military health, veteran health, active military support, mental health, social any work on social isolation is still happening. That involves a lot around senior citizens. So work around senior citizens is still a lot of work out there. Immunizations for children and children's health at large is still out there. Um, and then even employee health and wellness, and student health and wellness. A lot of work around students, a lot of work around employees and companies paying for employee wellness and well-being. Well-being is something that is being cited a lot. So yes, so there is a lot of work, part-time, temporary, contract, 1099. You just have to be mindful of the scams, the traps. I want to take a minute to maybe share my story of falling into a trap with an MLM. So I actually ended up working for Herbalife in college, and I was a recent graduate looking for work, just like some of you might be on here right now. And I was looking for, just something health-based, something wellness, something around health coaching, health education, anything. And I found a Craigslist ad. Of course, it was Craigslist that put me in this position. But I basically met with, my team leader. He became my team leader, and I bought product and I was selling product for about a year. So for about a year, this was like the months leading up to graduation at UCLA, and then through the summer and into the fall, right before I moved to get a full-time job. But I ended up really loving the experience because it opened my eyes to sales. In fact, that job is what helped me secure my job. So for those of you who are weary about working in retail or sales or doing something customer service related, I want to remind you that you don't need to be afraid. You don't need to be scared because sales and customer service, community engagement, knowing how to work with diverse populations and knowing how to seal the deal in conversations is valuable in public health work, is valuable for contract management, is valuable for partnership development as you move up your career ladder. So I will never forget when I was being interviewed by the American Lung Association for my first full-time job ever, that my future hiring manager wanted to know, have you sold anything? Can you tell me what you've sold? What's your experience in sales? And I'll never forget that question because he was interested in sales because he said, even though we are recruiting youth for a program and we're paying them through stipends and incentives, it's still a sales job because you have to convince the parents, you have to convince the youth, you have to convince them that it's worth it. And not only that, you not only have to recruit, but you have to retain, right? So that speaks to customer satisfaction. That speaks to being able to manage to program participants and stakeholders, right? And keeping everyone happy, all the parents, the investigators, the youth, the teachers, right? The teachers had to be happy too with my work. So you guys have to just, take a breather. It's not the end of the world if you have to get a part-time job, but even my sales job with Herbalife pushing products and nutrition vitamins and anything else that they were selling, it actually did help me secure my job at the American Lung Association because I had a little bit of sales under my belt, So please, please don't be afraid of taking on part-time work. I'm not saying you have to join an MLM, a multi-level marketing or pyramid scheme, as we call them, pyramid schemes. I just want you to trust that your transferable skills are there. That if you're in community, that if you're serving community, and if you have good intention, good meaning, whether it's to help with education as a substitute teacher, whether it is to go be a Lyft driver, like I had to be a Lyft driver, because you help senior citizens who can't drive, for example. If it is to go back and work in retail and serve diverse populations and make sure that they have all of their, answers to their questions, all of this is transferable. Okay. So I want to encourage you to get out there, get your job, whether it's part-time, temporary, contract, or full-time. And sometimes these contract or temporary jobs or even part-time jobs actually do turn into full-time work. There's a lot of promising stories out there where the employer actually took on the part-time employee because you demonstrated that you were worth keeping. So there is some promise in that as well, and I hope that you find a little bit of hope in this webinar. That concludes how to find jobs in public health for part-time or temporary work. If you are ready to get back to work, I am here as your #1 public health career coach, cheering you on. I know things will get better for you. Our communities need you. And I thank you so, so much for your service and your dedication to public health. All the best. Stay in touch.